Hello, everyone. This is Howard Catton, the Chief Executive Officer at the International Council of Nurses. And I'm delighted to be joining the Global Power of Oncology Nursing conference. I bring greetings to all of you from the ICN President, Dr. Pamela Cipriano, from our more than 130 national nursing associations right the way around, our special affiliates, of course, and indeed nurses right the way around the world. I think it's very interesting that you have named yourself as the global power of oncology nursing. The word power is a word that we are using at ICN much more over recent weeks and months. Our Congress next year, the theme for our Congress is Nursing Power to Change the World. And our theme for this year's International Nurses Day was the economic power of care. And I'm delighted to be able to share a little bit more of that report with you that we published on the 12th of May this year. The report's freely available on the website. You can see the cover page from on the screen now. For those of you who don't know, most of you do, ICN is the internationally recognized body to speak on behalf of the global profession to organizations like the World Health Organization, who we have special relationship with and a specific work plan of activity, but indeed a range of other international organizations, including people like the International Labour Organization, United Nations system as well. We're 125 years old this year, founded in 1899. We just had a big celebration event hosted by the Order of Romania in Bucharest to celebrate the achievements of the organization and the profession, but also to look forward in terms of the critical role of the profession to addressing all of the health challenges that we know that the world faces. The map you can see just highlights those parts of the world where our member associations, our national nursing associations, are operating. Here's a picture of the very first ICN board and the current ICN board. Interesting to look at some of the things that stand out from those pictures. Not only that we dress a little differently now, but we're clearly a bit more diverse now in terms of our leadership than we were 125 years ago. But our founders were phenomenal women who 125 years ago identified the critical importance of international collaboration, sharing, and learning to advance not just health, but very many of them were actively involved in issues to do with promoting social rights and social justice, including securing votes for women in their respective countries as well. I've mentioned that we set a theme for International Nurses Day every year, obviously the day where we celebrate the birth of Florence Nightingale. This just gives you a flavor of some of the themes that we've had over recent years. We've deliberately focused on issues like the Sustainable Development Goals, the targets for improvement that the UN is signed up to, 17 specific areas of work through to 2030. Health is one of them, but as we clearly demonstrated when we focused on the SDGs, nursing is relevant to very, very many of the other SDGs as well. We've looked at universal health coverage, again, another big global ambition to ensure that people right the way around the world have access to healthcare. We've looked at future of healthcare, future healthcare models, the importance of primary healthcare, the need to reorientate our health systems. And we've focused on, of course, the workforce issues, what needs to be done to protect, to support, to invest in the global nursing workforce. And last year we had a Charter for Change, which set out the 10 key points we thought that governments everywhere needed to be actioning. But if we're critical with ourselves. We make the health case for investing in nursing. We make the patient safety case for investing in nursing. We make the human rights case for investing in health and in the nursing workforce, but we still often struggle with breaking through to see the levels of investment that we believe are required. And that's why this year that we said we're going to take on directly the investment case. We're going to make the economic case for nursing and for care. And the evidence for that is detailed in our report. Firstly, I think everybody very familiar with the fact that ill health, poor health, costs national and global health systems huge amounts of money. It's estimated that the cost of treating harm caused during care can amount to up to 13% of total health spending in countries. Poor health estimated to cost global GDP up to 15%. I mean, the example that we all lived through about the economic and financial impacts of ill health, of course, is the pandemic. $2.5 to $3 trillion, it's estimated the pandemic cost the world, as we saw how when health collapses, it has a knock-on effect on all other parts of society, including our economies as well. High turnover rates of nurses, costs of replacing nurses varies, but estimated in many middle high income countries that can be $36,000 per nurse. And of course, the failure to provide healthcare for all results in the loss of lives, estimated to be around 60 million, but has the potential to increase life expectancy by 3.7 years if we do deliver that access. These are powerful figures, and these are not ICN calculations. We worked with people from the OECD, from the World Bank, eminent economists and professors as well, who provided this level of analysis. And what's striking is that for too often, I think the economic value of nursing has been dismissed or considered as irrelevant or ignored. I've no doubt that in significant part is to do with the fact that overwhelmingly 90% of our profession are women as well. But these are very powerful figures in terms of the costs of ill health. But if we then flip that and say, so what are the economic benefits of investing in health? And this may seem like a really obvious point, but important to make. We keep people well, we keep people healthy. If they work, they're productive, they're engaged in their societies. And those healthy populations, it's estimated, could then have a booster effect on global economies. We know that in many parts of the world, populations are aging. Therefore, keeping people well is essential to keeping a supply of labour to drive forward economies and economic growth as well. And that boost to global GDP estimated to be up to 8%. So there are not only the savings from avoiding ill health, there are the potential gains from increasing productivity. People are often concerned, politicians, about, well, if I invest, how quickly will I see a return on my investment? And how much will that be as well? Again, this report shows, the economic evidence shows, that for every dollar that you put into healthcare, you will at least double that. You will at least see a 1 to 2 return on your dollar invested, and it can be more. And significantly, it can often be much more in low middle income countries as well. So low middle income countries are, in a way, suffering the most because of ill health and the causes of ill health, but through investment can not only make those savings, but have a bigger dividend, a bigger gain to be made in terms of increased productivity. And then what about nursing specifically? The world, Dr. Tedros talked a lot about universal health coverage. ICN is very committed to ensuring that we're moving in the right direction to enable access to healthcare for all. The pandemic put us on track for that. But in order to deliver that, we all know that primary healthcare is a key enabler to universal health coverage, and that right across the spectrum of primary healthcare, you will find nurses and nursing work. It's been estimated that to achieve universal health coverage, we need to have a ratio between nursing workforce and 10,000 population of around about 70 nurses per 10,000 population. Currently, about 3/4 of countries around the world fall below that that threshold. So, nursing investment is key to delivering delivering universal health coverage, and as we know through primary healthcare, but also within acute care as well, it is now increasingly advanced and specialist nursing roles who are at the forefront of responding to non-communicable diseases, first point of contact in community care, lead clinician in terms of providing people with support over their from their cancer diagnosis over their cancer journey as well. And we at ICN have highlighted innovations in oncology nursing as part of the series that we did with the BBC on innovations in nursing that are taking place right the way around the world. I've mentioned before, of course, 90% of the profession being women. And again, it may sound very simple, but an obvious point to make. If we are investing in nursing, we are overwhelmingly also investing in women. So there's a dividend here, not just for health and for economies, but for addressing gender inequalities. And because of many of the issues that we know nurses are dealing with, and the range of impacts across the SDGs, nurses are absolutely also supporting the alleviation of poverty and therefore dealing with where there can be conflicts and tensions within societies as well. And we've said very clearly that we also recognise and promote the role that nurses have, not just as health makers, but as peacemakers as well. So there are these other benefits, powerful advantages in terms of not just health and economics, but also in gender, in poverty, inclusion, and peace as well. And for all of these reasons, we need to stop what's the thinking that we frequently come across, isn't it? That we'd like to invest in nursing, but it's a big cost. We don't know what the return is. The fear that actually in some way it's a brake on economic growth if we invest in nursing. Whereas what our evidence clearly shows is the opposite. Investment in health, investment in nursing is an accelerator for global economic growth. I said that it's not all nurses who've written this report. It's not us telling us what we think or we hope. The evidence to show it's what many of these experts from some esteemed organisations helped with the report, and it's their analysis as well. In terms of what needs to be done to support the nursing workforce over the next few years, we at ICN have also set out very clearly our own 10-point charter for change. It very simply describes the importance of investing in nursing education, both pre-registration and ongoing education, decent work, fair working conditions, addressing issues of violence, supporting nurses to work at full scope of practice, to remove the barriers where they exist, to fund nurse-led models of care, to reorientate our health systems away from disease and medically focused models of care, to ensure that we have nursing leadership at all key places within our health systems as well. and these 10 points in our Charter for Change align absolutely with the current global strategy for nursing and midwifery agreed by WHO back in 2024. We are, colleagues, just about at the start of really important 6 or 7 months for the nursing profession globally. We're now working on the next State of the World's Nursing report, aimed to be published in April next year. And from that, we will then, the World Health Organization and the Assembly, the World Health Assembly, when it meets in May next year, 2025, will make decisions about extending the current global nursing strategy. So the data, the evidence from State of the World's Nursing and the next global strategy is work ongoing now and to be determined and agreed in the first 6 months of next year, which will then give us the path for the following 3 to 4 years. I said a couple of times that our report wasn't just based on what we as nurses thought and had written, but on other organizations. And one of the other key organizations who has done very significant work in the last 2 years in recognition of the economic power of care is the World Economic Forum. They have had an expert group dedicated to looking at the care economy because they recognize that the care economy is an untapped source of opportunities for job creation, for income generation, for social mobility, and therefore health and nurses are key to growing the care economy. And they set out as well the evidence to show not only how more jobs are needed in areas like education and healthcare, but how much of care, what the value of care that's currently unpaid and overwhelmingly delivered by women is. But if we invest in that care, how it contributes to the development of our societies and our economies much more broadly. So very powerful to have the World Economic Forum. They discussed the issue at Davos, their big annual event last year. It's planned to be on the agenda again for this coming year. I mentioned universal health coverage a few times. This is our president, Dr. Pamela Cipriano. She's been asked to and is currently co-chairing a big global initiative involving all of the big global organizations, including WHO, World Bank and OECD, on promoting universal healthcare. I think it's a powerful sign of the recognition of the importance of nursing to universal health coverage that a nurse and the president of ICN has been asked to co-chair that work. I've said already a little about the importance of the next few months globally for nursing evidence, data and policy as well. And this is just one other example, colleagues, of where we need to take our conversations to and where ICN is taking the conversations to beyond our own bubble, to include the economists and the politicians and policymakers and the organizations that lead thinking on economic policy, but also the leaders of within G7 and G20 countries. We were delighted to have our Congress in Montreal, Canada last year. And our board, you can see here, our board was able to meet with Justin Trudeau to talk about investment in nursing. We talked about climate change. We talked about conflicts and disasters around the world and nurses' role in all of that as well. Dr. Pamela Cipriano, you can see her there. She's looking at Justin Trudeau, has actually written to the G7 and the G20 as well, making the case for investment in nursing and in health. So we have dialogue, we have discussion with, some of the most powerful people on our planet as well. Interesting, in this photo, the lady you can see in red sat the other side of Justin Trudeau in the red is the chief nursing officer for Canada as well. So it was great to have this conversation with him and the board, but also with his chief nurse involved as well. Colleagues, a number of these issues on where we are globally, the importance of investment, the economic case, as well as all of the other big global health challenges, including conflict and disaster zones around the world that we are all too painfully aware of, and nursing's response and involvement will be discussed and debated at the Helsinki Congress next year, 9th and 13th of June. I hope that many of you will be able to join us there. And for those of you who are particularly interested in advanced practice, you've missed the advanced practice conference, which was in Aberdeen, but the materials from that, including a new position statement and discussion document on the future of primary healthcare, are available on our website. And we're keen to hear feedback from people about the direction for primary healthcare that we set out, the vision that we described, and the importance of the nursing profession in that as well. Sorry, colleagues, that I can't be with you. I'm in another part of the world, meeting with governments and our associations. But I hope that's been helpful to bring you up to speed in terms of the evidence and the importance that we have been bringing forward, and we've been strongly advocating for in relation to the economic power of care, and that theme we will take through to next year's Congress on nursing power to change the world. Have a great event, have a great Congress. Hope to see some of you in Helsinki. Thank you.